Let's talk about dizziness, Western differentiation. From the perspective of Western medicine, there are generally four things that patients mean by dizziness, and they include vertigo, presyncopal lightheadedness, disequilibrium, and other. Vertigo is defined as illusion of movement. Presyncope is a feeling of faintness or lightheadedness. Disequilibrium is a feeling of being unsteady on one's feet, and other symptoms are usually described as a floating type of sensation. Peripheral vertigo. The causes of peripheral vertigo include otitis media, acute labyrinthitis, Meniere's disease, vestibular neuritis, benign paroxysmal positional vertigo, paralymph fistula, and cervicogenic vertigo. Peripheral causes tend to produce repeated attacks, and these tend to be recognized by the circumstances that provoke the vertigo. Inner ear problems, which affect balance, are the most common causes of severe vertigo. Acute labyrinthitis. This occurs during an acute febrile disease such as influenza. The sense of whirling that the patient develops has a sudden onset. Nausea and vomiting may occur. The patient has to lie flat, and the slightest movement brings on the vertigo. The symptoms gradually subside and disappear in 3 to 6 weeks. There's no accompanying tinnitus or hearing loss. Meniere's disease. This is characterized by recurring bouts of sudden vertigo, tinnitus, and deafness. In the intervals between bouts, the patient has complete freedom from vertigo, but the tinnitus and deafness continue. Central vertigo. The central causes of vertigo include cerebrovascular disease, including transient ischemic attacks, acoustic neuroma, multiple sclerosis, Chiari malformation, and any other conditions directly damaging the caudal brain system or the vestibulocerebellum. Acoustic neuroma. Acoustic neuroma, also known as vestibular schwannoma, is a benign, usually slow-growing brain tumor that arises from the Schwann cells covering the eighth cranial nerve. Damage to the eighth nerve produces vertigo, nystagmus or involuntary rapid movement of the eyeball, and hearing loss. The red flag in Western medicine, particular attention should be paid to vertigo lasting at least 48 hours. In this case, a cerebrovascular disease must be excluded. Thank you so much for your attention.